Thank you. Good afternoon, everyone, and thank you for coming. As Sam mentioned, we'll be discussing our community preparedness and response to the coronavirus, COVID-19. I want to thank the media for coming today and reporting this information and assisting us in providing accurate information to the public regarding our community response. As health and well-being of our community is our top priority, to date, the Tompkins County Public Health Department has been working closely with community partners to prevent and respond to COVID-19. As of noon today, New York State has announced that and have reported 142 confirmed cases of COVID-19 in New York State. There are currently no cases of COVID-19 in Tompkins County, and the burden of the disease in Tompkins County remains low. However, we do have one person under investigation. This is an evolving situation, and our information is based on what we know today. The county is preparing with our community partners, medical community, first responders, higher education, nonprofit partners, and other agencies in the community that provide a variety of services. We're also working in concert with our local governments and our state and federal counterparts as well. Response is ever evolving, and we're ensuring that our county staff and resources remain nimble and able to adjust accordingly to respond to the circumstances at hand. I've put together a crisis action team consisting of leadership from county administration, Department of Emergency Response, Tompkins County Public Health Department, and other county departments to continue to prepare and respond to COVID-19. Internally, we're reviewing plans and procedures to ensure that the continuity of community services remain undisturbed throughout this response. It's important to acknowledge that this is an evolving situation, and as we've already shared, there are currently no cases of COVID-19 in Tompkins County, and the risk remains low. Risk is determined in the manner in which we respond to an incident, and our goal is to be prepared to minimize the risk to our community. Now I'm going to introduce Frank Krupa, our Public Health Director, and he's going to talk a little bit more about our public health response.
Thank you, County Administrator Molino. The Tompkins County Health Department has been working in response to COVID-19 since the end of January this year, when the World Health Organization and the U.S. government declared a public health emergency, and we have been following the guidance of the CDC and the New York State Department of Health. Our public health response is led by our communicable disease team that is comprised of community health nurses and other supporting staff here at the department. On February 2nd, travel restrictions were put in place, at which point the health department began implementing precautionary quarantines for travelers from the Hubei province in China, as well as the mainland China. Those returning travelers were placed into precautionary quarantine for 14 days post their last time in China. The reason for 14 days is the incubation period for COVID-19 is between 2 and 14 days, and we want to ensure that they do not become symptomatic before returning back to their regular activities. Last Monday, on March 2nd, the travel restrictions expanded to include Italy, South Korea, Iran, and Japan. To date, we've had 47 people quarantined here in Tompkins County, 8 of which have been released from quarantine because they lasted the 14 days and did not become symptomatic. So we are currently monitoring 39 individuals here in Tompkins County. As County Administrator Molino mentioned, we do have one person under investigation with symptoms. That person has been isolated. We have collected samples and they have been sent to the lab, and we are awaiting those test results. So what is quarantine and isolation? There's an important distinction between the two. While they result in the same activities for the individual, they do have a different meaning. We quarantine those individuals that are asymptomatic or without symptoms and that are healthy but have potentially been exposed to prevent them from having contact with other healthy individuals. We isolate the sick. So if someone has become symptomatic, it is at that point that they are considered isolated. The situation is the same for them. Quarantine occurs in a very specific designated location for the purpose of observing and monitoring, and the department looks to make sure that they do not develop symptoms consistent with COVID-19. Obviously, someone in isolation already has symptoms. In most cases, people are quarantined at home as long as they can be separated from family and housemates. They remain in a bedroom and do not use common areas. The health department has community health nurses that are daily monitoring the individuals that are in quarantine, and we do that every day for the 14-day period. We are daily asking the individuals to provide us temperatures and other health-related concerns that they might have. If a person in quarantine develops symptoms, the nurse will determine if the person should seek additional health care and will inform the individual of any additional precautions needed to protect others. Samples would then be collected and sent to the laboratory for testing. The nurses are also checking on the availability of basic essential daily living items like food, water, and prescribed medications, and those will be evaluated throughout the duration of the quarantine so we can provide the appropriate supports to those individuals. It's important to note that the health department has a quarantine and isolation plan that we use frequently. We treat diseases in a similar manner, such as tuberculosis, mumps, and measles. We use these same protocols and practices, so we are well practiced. While quarantine numbers are important, it is most important that our community work together to take steps to protect ourselves and each other. To that end, we've had regular meetings with higher education, the hospital, county administration, and emergency response. We've held conference calls with school superintendents and skilled nursing facilities, and we've had presentations to the county legislature and the Tompkins County Council of Governments. We have multiple future meetings scheduled and conference calls to help community partners to continue to be prepared and respond. All of these are designed to share current information and facilitate our community response. How do we protect ourselves? The most important thing that individuals can do right now to help us prevent the spread of disease or COVID-19 is our traditional basic public health messages that we have been talking about. Stay home if you're sick, cover your coughs and sneezes, and wash your hands with soap and water often. Sanitizers are an alternative to hand washing if hand washing is not available, but we would encourage folks to use soap and water as their first course of action for hand washing. It's important that we all take personal responsibility to help prevent the spread of COVID-19. I'd like now to bring up Dr. Stallone to discuss our healthcare system's role in our response.
Thank you, Frank. Good afternoon. Echo our appreciation for you coming today and to spreading accurate information and education to the public. My name is Dr. Marty Stallone. I'm the President and CEO of Cayuga Health System. Also serve as the President of Cayuga Medical Associates, which is the hospital-affiliated practice of approximately 150 providers, doctors, nurse practitioners, physician assistants. And we work in close collaboration with a larger network of providers counting 400. There's 40 practices, 2 urgent care centers, an array of clinics and facilities. So I'm speaking on behalf of the provider community. My main message is that the provider community is diligently receiving and digesting and incorporating information from trusted sources, including the county and the state, as well as the CDC and World Health Organizations. Together, in conjunction with government and public health officials, we are ready and capable of responding to the spread of the viral infection and mitigating that. I'd like to offer assurances today through information provided, but I'm going to ask for your help in keeping this in context and spreading, communicating messages of education and personal hygiene and the like. I'd like to emphasize our own preparation that is noteworthy, the coordination that exists between government and healthcare organizations, and best practices to mitigate the spread and limit the spread of the infection. I'll start and end by emphasizing that there is a great state of readiness and substantial capabilities that can be brought to bear, and that we're working diligently to alter plans to meet the needs of the situation as the situation changes. And assuredly, it will change, and we're watching it very closely. To baseline, this is a communicable disease. It is a respiratory virus. As you know, COVID-19 is a coronavirus. We know a lot about coronavirus, though there are some aspects of this new strain that we don't understand. But what we do know is that the combination of virulence and transmissibility is cause for concern, and that's the call to action for the public, the community, as well as the provider community to take the appropriate precautions and steps to lessen the spread. In terms of spread, speaking of that, it is spread by respiratory droplet a mechanism. That is, the virus is shed from the upper respiratory mucosa, and spreading happens most substantially when patients are actually ill. The symptoms of the disease include fever, chills, coughing and sneezing, body aches, and when those symptoms are at their highest is when the transmissibility is greatest. That's actually an asset in the situation, unlike other viruses that are more contagious before the patient becomes symptomatic, and so spread is somewhat occult or not understood at the time that it's actually happening. So that's some good news. Spread is greatly affected by the behavior of individuals in society. Things like good hygiene practice that Frank mentioned, hand washing, and considerate coughing and sneezing into fabrics and spacing. These are all important steps that we can take. Separation or social distancing, as you may have heard from certain sources, is important in limiting the spread between individuals, as it is a person-to-person transmission mechanism. And then, of course, barriers, personal protective equipment, things like masks, face masks, gowns, in certain situations, PAPRs or positive airway pressure materials are important to limit the spread, particularly in hospitalized patients, although there are none at this point in this county, and we'll talk more about PPE in a minute. A word on treatment. The treatment is supportive, so it's supportive over-the-counter and in-the-home treatment that's indicated in the vast majority of cases. There's no active therapy, there's no available therapy that limits the natural course of the disease. We effectively get over the illness over the period of 1 to 2 weeks if one were to acquire it. Over-the-counter methods like Tylenol, ibuprofen, rest and hydration, and of course separation from other individuals to limit the spread are the hallmarks of management. There are treatments that are in trials. Right now, though none of those treatments are commercially available, and there's no vaccine available, though one is in development, as you might have heard from CDC sources. In the most severe cases, of which we have none in this county and are the minority of cases in the history of this disease, oxygen therapy, positive pressure ventilation, and other ICU-like treatments can be necessary. But I emphasize those are the minority of cases, and we have no such cases in the county at this time. Most treatment and monitoring can be done in the outpatient setting in the home under some sort of surveillance. In terms of interagency and interorganizational coordination, of course the hospital handles the medically complex cases if they were to occur. But again, most of the care is going to be in the community with surveillance, starting with medical practitioners, medical practices. Medical practices are who community members turn to when they're not feeling well. Those individuals, those doctors, nurse practitioners, PAs in all of the primary care specialties are trained and ready to route patients to the appropriate destination and alert the public health department so that proper case management can happen. In suspected cases, providers communicate early and frequently with public health authorities. Testing is available, and providers can order this, and best practice is to alert the public health department so that understanding of the prevalence and incidence of the disease can be understood and other decisions can be made with that information. In terms of capabilities and supplies, this has been an important question in society. I can report that the hospital and practices have sufficient supplies of materials like masks and other materials, gowns, and personal protective equipment. Our first priority is to keep our workforce healthy, to be able to respond to cases in the community, and we're working with community partners to streamline processes and do the same. In the event that a patient does need hospitalization, we have other equipments. We have respirators if need be, if the disease becomes severe. We also have negative pressure rooms, which simply ensure the air circulation is contained to the patient. And again, strict separation is the principle that we abide by, all the while keeping our staff safe. I'll end by stressing, before questions, that we're committed to improving and monitoring our preparedness and working with other agencies, outpatient providers, hospitals, county authorities, public health authorities, to make sure that we adequately respond to the dynamic changing nature of this situation. Right now, I would think that the county and our resources are responding well to the situation, and as was stated initially, the burden of disease is low at this time, though we're carefully monitoring the situation. So that concludes our formal comments. We'll now entertain questions to anyone individually and prioritizing the media guests. Yes.
There's, just in the past few days, we've heard from Senator Gillibrand saying that there's more effort going into community health centers, and also that tests are getting out to local communities, but we're getting mixed messages about whether places actually have tests. So given that we're in a unique position, what's the situation? Are you able to test? It sounds like the person who's under investigation, that had to be sent out.
Testing, the capability for testing, I know Frank is going to say some words about this. I'll just say the capability for doctors to order tests from various sources is increasing. And one of the principles is to make sure that testing is able to be counted at the public health department. I'll let you make a couple of comments on this.
Thank you, Dr. Sloan. Thank you for the question. The testing availability is evolving, and each day it's becoming more and more available. Right now, our recommendation to our community is that if they are ill, they should reach out to their healthcare provider who can help guide them through that process. And we are continually communicating with our healthcare providers on any instances that they might have questions about testing or anything else related to COVID-19.
And my follow-up has to do with a further breakdown of the numbers. So of the 39 people who are now being monitored, are any of those students or faculty who just came back because Cornell canceled their Italy program? And if so, how many?
All of the people being quarantined, it's important to remember, are asymptomatic,
Right.
and they are there because of a travel history. And we have individuals that have travel related to higher education, to business, to leisure in our community, and we are treating them and this as a community response.
So you're not going to specify sort of a breakdown of
No, ma'am.
anything? Okay, thanks.
Are the providers who are not part of the Cayuga medical system as in the loop with the health department and county and so on as those who are?
We've had regular communications with all of our providers here in the community. It is something we do on a regular basis related to different changes in the healthcare system, and so it's something we're well practiced at, and certainly having the health system as a partner helps get it out more quickly, and then we're making sure they're all getting the information.
Thank you.
For the person who's under investigation, why exactly were they put into that category, and where are they being held?
So for the person that's under investigation, they have been isolated. They are symptomatic, and so we want to get testing completed so we can confirm. For privacy reasons, we're not going to be disclosing any more information about the individual.
Do you have any sort of timeline for when those tests will be back? Did it go to the state lab in Albany, or was there a local lab that was performing the tests?
We're monitoring it as closely as we can, and we know New York State is working hard to get testing more readily available and quicker responses. Other than that, as soon as we have more information, we'll be sharing that.
Is that me?
Sure.
For students on spring break traveling back in the next 2 weeks, is there any concern for kids who might be going back to Westchester or other areas where there have been confirmed cases?
This is certainly an evolving situation, and related to travel right now, it's those 5 countries that we're still monitoring. But certainly we'll be keeping track of those events as like spring break and where additional travel might occur. Our real ask right now is we need folks to take personal responsibility, and as this evolves, if they're finding they've traveled to a country that has been added to a list by the federal government, that they let us know when they return so we can work with them. And certainly if anyone becomes symptomatic, we would want them to reach out to their healthcare providers.
I know you mentioned social distancing. It's been mentioned in other counties that they're not exactly telling people to stop shaking hands or anything like that. Do you have a recommendation specific to that topic?
Well, our basic message still holds true. We want people to stay home if they're sick, cover their coughs and sneezes, and wash their hands often. often. Beyond that, we are not recommending the canceling of any events. What we are recommending is that individuals in the vulnerable populations, meaning senior citizens, those with immunocompromised situations, or underlying health conditions, they should be mindful of where they're going in the community because they are the most vulnerable. But they should really already be taking those steps because we're in the midst of a very difficult flu season as well, and all of that would hold true for flu. Start here in the front.
I've seen people wearing masks out in Target or just around. Is that an overreaction or is it a good precaution?
We are only recommending that healthcare workers that are providing care to potential or confirmed cases need to be wearing appropriate PPE, including an N95 mask, unless someone is actually sick. And at that point, they're wearing the mask to protect the rest of the people around them so they're not spreading their illness. But other than that, we are not recommending masks for the general public.
Could you describe the relationship that the health department has with Cornell University as you're navigating through this situation? Is Cornell University advising the health department?
So we have relationships with all of our higher education institutions here in Tompkins County, and we've been working very closely from the beginning with all of them. And they have been very good about working with us from a local perspective, as well as heeding the guidance that we've been passing along from the New York State Department of Health and the CDC.
Was the health department involved at all in the recent expansion of Cornell's, the new travel regulations they released last week?
We've been working in partnership with all of the higher education institutions, and it's important to point out that organizations certainly have the opportunity to take steps that they think are most important to protect their constituents, and we support and are partnering with all of them. Follow up, Matt?
Yeah, how do you define, this is not at all on that topic, but how do you define exposed?
Typically, the exposure is within 6 feet of an individual that is a known positive carrier, a tested positive carrier of the disease. It's also if you come from one of the level 2 or level 3 CDC designated areas of the world where you would automatically be presumed to be of sufficient risk to be put into quarantine. So it's those two things. And typically, it's again a respiratory droplet mechanism where the virus stays in the air for a certain amount of time. So any real close contact within 6 feet or direct contact with a known positive case, that would constitute direct.
Yeah, could you explain different masks and their value in terms of preventing the spread either of the flu or COVID-19?
Right. For healthcare workers, it's typically an N95 mask that is produced by a number of vendors. It's a fit-tested mask, so you go through a specific regimen with a bioengineer who makes sure that the mask of a certain size works the right way. You actually should test the mask when you put it on to make sure that there's a seal, and if your face were to change for surgery, or if you then grow a beard, if you're in the case of an individual who can grow a beard, you should get refitted. And these are the processes that healthcare workers go through to ensure that the protection. But 95 refers to 95% of the particulates are filtered out. Is this what making?
Yeah, we're all looking at
Everybody's looking
You
at me.
have to get refitted if you didn't have it. If you get fit with the beard, and that's typically the 95 refers to the percentage of particulates above a certain size that are filtered out, which would bestow protection.
And so when we see people walking around with the flimsier, or when you go to the doctor and they say if you're coughing with this, what is that mask?
It's simply less effective than a professional grade masks of the kind that we would issue in the hospital setting to protect workers who were directly taking care of patients who were tested positive. There's some benefit for reducing macro droplet spread, but it's just not effective as the N95 variety of mask. And then of course there's full shields with positive pressure of the kind that would provide 100% closed air circuit through a HEPA filter and the like.
Can I pivot for a second to the flu? Compared to COVID, so we know you've said that the risk to COVID-19 is very low in Tompkins County.
We said the burden at present. The risk is actually high, but it's mitigatable depending on how we act as a community to reduce it. And
okay, so burden means?
Burden means the affliction of the disease on the population in terms of a number of positive cases and how many people are actually contracted the disease, which right now is 0.
Okay. And then how does that compare to the burden of the flu or the risk of getting the flu?
Right. I
now?
think the concern with this particular virus is the trajectory and what might come of it. And again, it's the combination of transmissibility and virulence or severity of the disease. And so scientists have determined it's more virulent and more transmissible. In some viruses, Ebola as an example, it could be almost so virulent and lethal that it kills itself out in certain situations. So this has the ability to spread and afflict a population. That's not a prediction, that is a concern, and it's a call to action to act in particular ways to prevent it. Hence the strict hygiene requirements and the protocols we've been talking about here, and the calculation and the vigilance around travel that causes concern, and then symptomology so that you get into a tracking situation with the Department of Health. Does that make sense?
Yeah, actually.
Good. Amazing, right?
I understood.
Yes.
I know that recently New York State received $40 billion in funding for this. Like, has any of that funding gone towards Tompkins County, and if so, like, how is the county using this funding?
Yeah, I'm gonna hand that off.
So the governor declared a state of emergency, and the state legislature also approved a $40 million relief or $40 million aid spending to address this issue. Right now, the majority of that, from our understanding, particularly the state of emergency being declared, is really about being able to expend funds in an easier way and procure funds in an easier way to address the issue, whether it's buying supplies, providing additional transports for potential patients, opening up additional testing facilities throughout the state. So a lot of this has to do with the state's ability to respond and provide resources to really the frontline folks to be able to address this issue. So right now we have not received direct aid from the state on this issue, but as I suspect as this evolves more, we may have additional resources provided to us.
Because Cornell does a lot of business and has students from all over the world, has that affected how the county is handling this situation?
Our response is based off of our community, and there are many partners that have constituents that have international travel. And so, again, we're addressing this from a community perspective, and anyone that's here in Tompkins County is part of our community, and we're going to work to keep them safe and healthy. And I did want to follow up. There is a good point about the soap that was brought up. It is still our primary ask is that folks use water and soap to wash their hands. It's the best way. Hand sanitizer should be used in situations where you're not able to access water and soap. So as people are trying to find hand sanitizer, it is important to remember that the message is please wash your hands with soap and water. Hand sanitizer is an option if that's not available.
I don't want to keep harking on the semantics of risk versus burden, but in previous health department statements, it was stated that the risk is low for Tompkins County community members. And so are we saying now that it's inevitable that COVID-19 is going to come to Tompkins County, and if so, what does that timeline look like?
The risk is low, and we've been saying that because there's not an exposure path at the moment. We don't have a case here in Tompkins County.
Yeah.
As far as your other question, we are obviously following the disease in New York State as it's moving to other counties, and we are prepared and ready to respond in the event that we do have a case here in Tompkins County.
Where would a positive test, if someone does test positive, where would they go from there? Where would they be held or anything like that?
That's a good question. So it's important to go back to that question about isolation and quarantine. They have already been separated from other individuals because they've been isolated because of the symptomology, and so they would already have been separated and would remain there until they were healthy and had resolved the disease. So knowing that someone is positive doesn't really change anything for them in this current situation because they're already in isolation. What it changes for us is we then expand our contact investigation because now we have a known case, and we would want to make sure we were reaching out to anybody that was a contact so they could take the appropriate precautions to help us prevent the spread.
So 2 weeks is a long time to be away from work or school. Have you had any pushback from people who needed to go into quarantine for 14 days?
The great news is to date we have not. Everyone has been extremely responsive. They understand the situation and they get their personal responsibility in helping us prevent the spread. So we've been fortunate that we've not been faced with that. But if we do, we will work with those individuals to help them navigate quarantine as best we can.
And as a follow-up, are you working with employers to understand that?
We've not yet had that need, but certainly if someone we had in quarantine was facing an issue like that, we would work with them to support them in any way we can.
For Mr. or Dr. Salone, does CMC have the capability to provide the in-home monitoring you were talking about?
Can you clarify the in-home monitoring?
I think you said that if someone's sick or in isolation, they would be, or even under quarantine, that they'd have like in-home monitoring. Like they would be
Right, so
monitored.
that's actually, there's a spectrum of response based on how ill the person is. In the case of quarantine, they're not ill, and we're waiting to see are they positive or not. That's certainly in a home setting, an outpatient setting. Isolation can also happen for positive cases if they're not ill enough to warrant coming into the hospital. In both those cases, separation is accomplished from other individuals, and clinically, in the case of a positive test, if they needed hospitalization, they'd remain separated with healthcare staff using PPE and barrier protection, and they come into the hospital but remain separated. So in all situations, they remain separated. Frank will expand. Sure.
Yeah, the specific question about monitoring of those folks that are in quarantine and isolation is being done by the health department. So our nurses are making daily contact with the individuals, again, to ensure that first they're remaining asymptomatic, but also to check to see if they have any personal needs that need to be addressed. So that is being conducted at this moment by the health department. Yes, sir.
Do you have any sort of expectations, or are you making any sort of preparations as for when IC or Cornell students come back from spring break?
Yeah, we've talked about that question. We're working with our community partners so we can understand any potential situations that we need to be preparing for. But again, at this point, there are only travel restrictions related to those 5 countries. And as individuals do return to the community and this continues to evolve, we would obviously be working with the New York State Department and the CDC on any additional guidance related to travel. On the way back?
I was just going to say, there are parents at of kids of local school districts that are really, really concerned to the point that they're saying, should school even be open? And can you kind of put in perspective and maybe put them at ease a little bit about the situation in Tompkins County?
Sure. We do not have a case of COVID-19 in Tompkins County today. So that's probably the most important message to parents at this point. We are working with our schools so that they are prepared and understand that we're giving them up-to-date information so they can react and respond as appropriately. And right now, folks should generally be going about their daily lives unless they're in those vulnerable populations. And then they should be mindful and thoughtful about how they approach it. But they should be doing those things related to the flu as well.
Would you advise that parents of immunocompromised kids pull their children out of school?
I think that's a conversation for them to have with their healthcare provider to make those decisions on a case-by-case basis. And if there's any questions from them or their healthcare provider, the health department would stand ready to help them navigate those questions.
This is for Jason. The health department said that they wouldn't be recommending the cancellation of events, but has that thought crossed your mind? Like there's a music festival coming up or like legislature meetings. Has it crossed your mind to cancel those?
You want me to cancel legislature meetings, Matt?
Fingers crossed.
We're gonna follow the direction and coordination with the public health department, and working with them and working with the guidance we're getting from the state health department. So in this case, individual organizations, whether it's higher ed or private business or school districts, they have to make decisions based on their assessment of circumstances. We'll obviously help in that assessment the best we can. So that's really the best approach we're taking right now.
While you're there,
Sure.
Would you talk about whether you're hearing at all from businesses and whether, because there's so many small businesses in Tompkins County?
I know the Chamber of Commerce has also offered some guidance in terms of
encouraging businesses to look at their continuity of operation plans, and we're doing the same as we are internally. I think that's the best advice we can give to businesses, small and large, is that now's the time to look at your continuity of operations, understand your critical services that you need to continue to provide, and the staff that you need to do that. And if there are other alternative means for that staff to continue to do that work, you have to evaluate those circumstances based on their needs.
To follow up on her question, are businesses reporting less business?
I have not heard anything along those lines.
Well, if there's no further questions, we definitely want to thank everyone for coming today and helping us get the message out to the community. So thank you all very much.
Thank you.